Big congratulations to Dr. Rucha. As a dentist from India, she has passed her FSP exam in the first attempt, and we are so happy for her. We wish her all the best. Congratulations, Dr. Rucha. Congratulations, madam, for passing your exam. I'm so
Thank you
happy for
so much,
you.
sir. Thank you, sir.
It's all your hard work, Dr. Madam, which have got us the result, and we are so happy
Yes,
for
yes.
you.
Your help and hard work.
Yeah, you can say that way, our help, but all your 99% credit should go to you. We are just a medium.
Thank
And
you, thank you.
I was just eager to know, doctor, that once you reach Germany and all, how were the services? Was there German team from Mission Germany? Was there any help to you?
Mhm. Okay, so sir, right from the point I reached Germany, I think you were always in contact with me, right from booking my flights to reaching here. And after I reached here, then you made sure I reached safely. I went to my hotel, Airbnb, or the apartment that I found was at safe. You made sure that everything was properly executed. And when I reached, you also told me the basic procedure that has to be done. That, for example, you have to register in the city where you are in for city registration, or getting a bank account, like simple basic things that are needed. And so I think it was very helpful because because when people come here for the first time, they don't have an idea of all of this. They don't know that there are certain things that have to be done. It's not just about going to the language school. It's also about doing things like opening your account or registering in the city, or just getting used to the weather, the people, and the environment. So I think that was very helpful because you gave me a prior idea of everything that has to be done. And you were also checking up on me all the time that, okay, have you done this? Have you done that? Now this is the next step. You have to do this now. You have to do that now. So that was very helpful, I would say.
How you prepared for your FSP exam and
Mhm.
the course which you took for FSP exam, was it really useful, or how you feel about the course actually?
Okay. So that was one thing that I really liked because I think I did not have to search for the course myself. You searched for me, and thus the course you provided for us was very, very helpful. I think because it was a private course, it was not a course that publics here it is publicly available. It was a private course. It's a paid course, but I think it is very useful because the teacher that was there in our course, she was very helpful. She provided all the right material which is exactly useful for the exam and not just for exactly useful for dentists, I would say, because there are courses for medical people and there are courses for dentists, but what is taught in the medical field or for doctors is not taught for dentists. So this teacher taught us everything related to dentistry and what would come in the exam. So she provided a proper structure of what would come in the exam, what I have to learn, some tips and tricks that you have to learn. So that course was very useful, I would say, and the material she gave was very helpful, through which I could actually study and prepare for my exam. So I think I studied for like the course was 2 months, and it was also the timing was so convenient for me that I could also work in the morning and then do this class in the evening. So that was one useful thing because the other classes are generally in the morning, and when you do these morning classes, you don't have time to work and you don't have time for anything else. So that was one very important thing. So I was working, and at the same time I was studying and doing the classes. Yeah.
How was the pattern for the FSP exam? Because
Mm-hmm.
people always have doubts for dentists, ki, sir, is the pattern same for doctors and all. So if
Yeah.
you can just elaborate ki, how was the really, what you felt in
Mhm.
the exam, what steps were taken and other things, that will be great help.
Okay. So the pattern is, so it's like the Fachsprachprüfung is basically to do with language, German language. So it is the basic pattern is the same. There are 3 parts of the exam. The first part is the doctor and patient conversation. So there is a doctor who, so you're the doctor and there's a patient who is like an actor. The 2 examiners, one of the examiner is an actor. He comes, or she comes to you, and he tells you the complaints. So I am having pain in the right side since 3 days, 4 days, whatever the complaints may be. And then according to that, you have to ask questions to that patient according to the case that has come to you. So there are different cases that can come to you. There can be anything. There are multiple cases that can come, and according to the complaints that the patient is telling you, you have to ask the right kind of questions to that person. And then when you you have to jot down all the points what the patient has said. Then you have to say all of this very confidently in the right German and in like the right format, basically. So there's a format of taking in history of the patient and asking specific questions related to that specific case. And then after that, this lasts for 20 minutes. The second part is the written part, where you have to write a arts brief, that is called like a doctor letter, where you have to write all the complaints of the patients, the diagnosis. So what is actually the diagnosis of that case that has come to you, and the therapy plan. So what are you going to do in this case? If this person comes to you, what would be your therapy plan? So it does not have to be the same, because all doctors are different. You can have different therapy plans depending on what kind of treatment you want to give the patient. So it is this exam is not about how much correct dentistry you write. It is about being confident and writing in the right kind of German, and just writing theoretically correct points. It does not have to be perfect. So there's a second part where you have to write a brief for the patient, and you have to that is also for 20 minutes. And the third part is also 20 minutes, where it's like a doctor-doctor conversation. The doctor-doctor conversation is where, related to your case, the second examiner asks you questions about, okay, so what would be your therapy plan? What would you do after this? And if not this, tell me other things that you see on the X-ray. How can you solve these problems? So the patient only comes with pain, but when you look at the X-ray, there will be some other problems related to that patient, which you have to actually explain to that patient that it's not just important you get this part of your mouth treated, you have to get all the other things treated as well, because those are equally important. So they ask you questions about other things related to your case, and also general dentistry questions, but they don't go too much deep into dentistry, because it's just Sprachprüfung basically. So they just basically want you to be confident, speak the right German, and act as if you're a doctor and be confident. That's it. And I think I prepared that way, given the full the course and everything. I prepared in that way, and that's why it was easy for me to give the exam, I would say.
Overall, doctor, you found the exam to be easy for you?
Yeah, I thought the exam was very easy for me, and I prepared just for a month, I guess. But everyone has different timelines, everyone has different grasping process, and it depends how much time you need. That you have to judge for yourself. But I think overall the exam was very easy because, of course, your guidance, the class, and my effort, I would say.
Dr. Bottom line is what I always tell to every student is that, you see, if you are clinically good in your trade, if you have done work in India, and if you are good in German language, I think this exam should not be a problem if you do the basics.
It should not be a problem. That's true. And what you have been telling me from the start is to focus on language right from India. I used to feel that, why are you giving so much importance on language, and why is it you're always telling me, nahi, language pe dhyan do, Dr. Saab, language pe dhyan do. So I think that was very important, because language is important. I think it is important that you focus on language. It is important you come here and talk with the locals, make local friends, and improve your language as much as possible. If you are good in language, the exam is very easy. Because basic dental knowledge everyone has. You have studied for 5 years in India, you would have that knowledge, and you can easily answer the questions that they are telling you in English. You should just be able to do that in German. That's it.
Fine. Thanks a lot, Doctor, for all your guidance. It will be helpful for other students who will be going to Germany now. Doctor, you cannot believe it, how happy I am for you. Practically speaking, I have a feeling that you have passed the FSP exam, but I am celebrating that I have hit a century.
Oh, thank you.
So your reaction are mild and mellowed down. I don't mind shouting and screaming on the main road also. I'm so happy. I mean it.
Thank you so much, sir.